Much, Leo. I am very honored and humbled to participate in this series of talks. And I will try to have a conversation and reflect together with you, as I am basically a journalist, and as a journalist I am expert in nothing but a bit of trying to connect the dots of everything. And in my advocacy work and civil society work and so on, that's what I was trying to do in watching policies and trying to see what works, what doesn't work for our peoples. So in that sense, well, what information and data and so on that I want to present should be trying to kick a reflection rather than provide answers. Actually, we are in the middle of the crisis, in the middle of the pandemic, and when we hear the scientists, we are humbled because the most often reply to all our questions is, we don't know. We don't really know. And of course, politics get desperate with that kind of answers, but that is what is science allows. So that requires quite an imagination and a sense of direction when we try to see what do we do, what are the next steps. It's yeah. So let me start by showing some images that might help us think things through. 1 second here. I am trying also to cope with the technology and to find my way in this new era of Zoom and teleconferencing and so on, which we are starting to think is part of the new normal. So if I can share here. Okay, the first provocative affirmation that I want to start with is, don't say nobody warned us. We hear now and then, oh, we couldn't see this coming. Now, listen to this quote. There is a very real threat of a rapidly moving, highly lethal pandemic of a respiratory pathogen killing 50 to 80 million people and wiping out nearly 5% of the world's economy. A global pandemic on that scale would be catastrophic, creating widespread havoc, instability, and insecurity. This was said last year, September 2019, months before the first coronavirus case emerged in China, in the report of the Global Preparedness Monitoring Board, which put up this report, which includes this prediction of a global pandemic, which is so far and thankfully a bit outstretched in the damage to the lives of people, but it's quite accurate or even underestimated in the damage to the world economy. Around 5% of drop in global GDP is what IMF, World Bank, and other organizations are predicting, which is something that is not known in the world for many, many years, and probably equivalent or worse in terms of the economy than the First and Second World Wars. So that was predictive. It was predicted. It was envisaged, and the board that prepared this report included people highly respected. The report was commissioned by the World Bank and the World Health Organization, and the committee, the Global Preparedness Board, is still headed by Harlem Brundtland, the former Prime Minister of Norway and former Director of the World Health Organization, by the Secretary General of the International Red Cross, and it included the highest officials in charge of controlling epidemics in China and the United States, George Gao and Anthony Fauci. So everybody knew that something like this was coming since the Ebola epidemic of 2014-16. And the probabilities of something like this happening really are based on the massive destruction of the environment that creates the conditions for virus jumping from animals to humans, which is something that I understand, has happened always, but in the tension on the natural systems, this is pressed and would happen more. In light of that, the second step, after having seen the danger, was to prepare for it. That's the name of the board. Be prepared for such a threat when it comes. And again, since the Ebola outbreaks and the outbreaks of SARS and so on, people saw it coming and thought that they would need to be prepared. And the same funders that funded the report about the risk, one of them, the biggest of them, is the Bill and Melinda Gates Foundation. And many have seen a video of Bill Gates repeating this warning of how an epidemic would happen. And people have said, oh, what an extraordinary vision and predictability for the future. Now, these same people put the best heads in the market to think about how do we prepare countries and how do we know who is prepared and who isn't. So again, the Bill and Melinda Gates Foundation, Robertson Foundation, Open Philanthropy Project, and others put a lot of people, a lot of scientists from around the world to work in development a global health security index. That index would analyze different categories, capacities to respond to the epidemics, the capacity to knowledge capacity, hospital beds, and many, many other things, dozens of indicators and sub-indicators and so on, were put there to work. The funding of these institutions and the work of developing that index was done by the Nuclear Threat Initiative, by the Johns Hopkins School of Public Health, which is the main provider of all the statistics about the spread of coronavirus that we see every day around the world in the press, and that I am also going to use in graphs and so on. and the intelligence unit of the Economist Weekly magazine. So that team came out with the conclusion that I'm going to show you about who is prepared and who isn't. And the best prepared country in the world to face the pandemic, according to all these people, is the United States. And the second prepared country in the world is the United Kingdom. And I hope you can see the graphs and so on of how countries are ranked from top to bottom in that index with circles that I suppose are proportional to population. And at the bottom of the scale, of course, are the African countries, Sub-Saharan and West African countries, which are deemed to be the worst prepared, and Venezuela. Now, if I could see the faces of the audience, I would see some people surprised, other people laughing, and so on. And because in a way, this index, as you can intuitively see, instead of predicting who was better prepared for the crisis, it predicts absolutely the opposite. No? It completely fails to tell us which countries will reply better or fare better in the pandemic. But this index had major consequences. I would say that it probably costed the lives to thousands of people without exaggeration, because when COVID-19 started in China, people looked at this chart and said, well, obviously, China is so badly prepared for this crisis that they have to take very dramatic measures to confront it. And this is not a problem for us being those on the top, you know. Those qualified as highly prepared are, you know, all G7 countries, are all countries, leading Western economies. President Trump said, we are prepared to face the pandemic. There is nothing to worry about, based precisely on this kind of information. Now, what this makes us think is, how come that the best minds and experts on health could have that vision of their own preparedness, their own capacity, that then took them completely by surprise. And people that have looked at that, even, of course, once the crisis started to develop, lots of people are looking at that index and saying, hey, what went wrong here? And how could this been so badly analyzed? They noticed, for example, that the global organizations working on health, 85% of them have headquarters in Europe and North America. And actually 2/3 of the global organizations working on health are based in 3 countries, Switzerland, the UK, and the United States of America. So in a sense, it's a self-congratulating index, what we see. And it's an index that correlates highly with GDP. The richer the countries are, the best prepared they are. And it's an index that in the selection of the indicators, in the weighting of the different parameters, and so on. A lot of information is in there, no doubt. When you look at the country by country analysis that the index provides, it is there is a wealth of information about capacities, health systems, and so on. But it is in the weighting, in the averaging, in what is considered and what not. The vision is basically the vision of the official development assistance. It's the traditional vision of the developed system that says that everybody should develop into what the rich countries are right now, and their expertise, their advisors, their technicals, and their health corporations are those that will tell the world how to go and shape the health system of the future, as happens with other aspects where they provide the advice, they provide the money to pay for the advisors, they provide the loans and the grants, and the least prepared countries, all of them in the global south, will have to follow that advice, and we have to buy the products, medical products in this case, that they sell us. Now, when we pass from the index to the reality, and here I hope you are seeing this map. This is the map of the incidence rate. So it's not the number of cases, an absolute number, but the number of cases in proportion to the population. So it's the how serious the pandemic is in each place in relation to the place itself, not in an absolute number of how many people are affected. And it has also the advantage that it's not, the dots are placed not as an average of countries, but according to the places, which is mainly cities and big cities, where the pandemia is happening, where the incidence expresses itself. Now, this map, which it reflects the data of yesterday, and which is, of course, still evolving, is not the final map of the pandemia which we are in. You know, if we had made this map in February or in early March, it would have looked different. You know how pandemia was spreading. China, then Iran, then Europe, later the US. But at this stage, we can already ask many questions by looking at this map. First of all, is it that the rich are suffering the most? When you see this map, and if you compare that with the basic indexes like the gross domestic product per capita, they seem to overlap. The poor regions of the world, Africa, Southeast Asia, mainly, have been spared so far from great impact of the pandemic. Now, we don't know what will happen tomorrow. We don't know how it will evolve. There are many factors here at play. And we have two aspects here also to consider, that within the rich countries, it is obviously the poor, the vulnerable, the ethnic minorities that have an incidence rate much bigger than that of the national average. So the title about are the rich suffering the most is provocatively placed, thinking of countries and in the traditional north-south division, and on averages, country averages, but not what is happening within countries, certainly. And then this is a picture right now, and we don't know about tomorrow. Factors that can be at play are, for example, the winter that is starting in the southern hemisphere, that is starting in South America and most of South America. And could that be a factor? Same as the summer starting in Europe, in the US, could that be a factor in the fading out of the pandemic? We just don't know. But again, as we don't know, we have to imagine, we have to formulate, like the detectives and the crime movies, hypotheses, and look at the links or coincidences that may or may not end up being coincidences. And one of my favorite clues is that this map largely overlaps with a air pollution map. When you see the air pollution maps, particularly the concentration of particles in the atmosphere, there is a large overlap. In Europe, the east coast of the United States, the eastern coast of South America, the big cities that are highly contaminated in their air are also suffering a great incidence of the pandemic. And there you see the Gulf countries, which Emirates and so on, which are also have, in proportion to the population, a high incidence, and which are, of course, highly polluted countries because of the oil production. Now, this kind of correlation is an hypothesis. It's just interesting to note. I am not sure what more we can say about this, but some people have advanced notions that maybe the virus can somehow piggyback on contamination particles and transmit better than in areas where there is no such contamination, such as, for example, most of Africa that has not industrialized, or Eastern Europe that has suffered the pandemic much less than the more richer and theoretically better prepared Western Europe. Southern Italy, which is poorer and not industrialized, has suffered the pandemic much, much less than the highly industrialized Northern Italy around Milano and so on, where the incidence has been the worst. In all those cases where there is a high incidence, yes, the poorer people are suffering the most, among other cases, because as soon as the pandemic started, the rich took their private jets to move into some isolated islands, and the not so rich, the upper middle classes, moved out of their homes in the city to the homes at the beach or in the countryside, and to spend the quarantines and confinements there. Now, moving more into the subject of our conversation, this graph here is sorted according to the number of deaths of yesterday. And we have on top Brazil, that yesterday had over 1,000 deaths, people dying from COVID-19, and this is highly, highly underreported. The press has been publishing, 2 health ministers have resigned in Brazil since the pandemic started. Until now, General is in charge of the health ministry, and there is a lot of pressure from President Bolsonaro to make sure that the statistics don't surpass 1,000 deaths a day. But still, this is what is coming out. And out of the 10 countries with the highest absolute number of deaths. This is not relative to population, it's the actual number of how many people died yesterday of COVID-19, registered, documented, tested, and diagnosed as such. You have 4 Latin American countries, Brazil, Mexico, Peru, and Chile, among the 10 worst. So this is worrying us a lot, and this leads to the issues where closer to me I can talk a bit more as to how come and why this is happening. This map is also a graph of the new cases of yesterday, June 11th. And the darker countries are those spots that have a major increase in new cases. And darker spots in the world are in Brazil, Chile is the worst situation yesterday, Peru. So that's where more people in absolute number, sorry, not in absolute number, per million people are getting sick of COVID. Now, again, this is what is happening today. We don't know tomorrow. And is it going to affect Africa or Southeast Asia that have so far been spared or not? We don't know. But in a way, what some people are saying in Latin America is the 4 weeks delay that we are having in relation to how the curves evolved in Europe, or 2 months delay in relation to what happened in China, allow people to look at how are things evolving in other places and hopefully learn from them or not. If we look at the evolution, here you have those 4 countries where yesterday most people died in Latin America, and in the case of Brazil, in the whole world. And this is the graph, day-by-day graph of active cases, meaning the cases that have happened and have been diagnosed minus those that have been cured and those that have died. So these are how many people are currently being sick of COVID. In Brazil, the figure is around 400,000 people. In Mexico, 20,000 people. In Peru, 125,000 people. And in Chile, it's around 60,000 people. With that drop that you see and then high again in Chile, this is not a second wave, or this is not something happening really in the ground. It has to do with how statistics is collected. And a few days ago, the number of active cases dropped dramatically just because the number of deaths has been computed. And then the day where a lot of people were officially recognized as having died from coronavirus, the active cases dropped dramatically. That's tragic. But that also reflects how little, or how the graphs and the official numbers only reflect part of the reality. Many, many cases go undiagnosed. Many, many people die for reasons which may or may not be related to the pandemic, but that have not been included in the statistics. On the other hand, the good news is that some countries seem to have fared much, much better. So you have Cuba, where the total number of active cases never reached 2,000 and is now below 250. Jamaica, where again the total number of COVID cases active never was more than 400 simultaneously, and now it's to 200. 200 people, not absolute numbers. Costa Rica, where again only 600 people were simultaneously sick at any moment, and then the figure dropped. Now it seems to be going up again, but still way, way below 1,000 total cases. And my own country, Uruguay, that had 3 new cases in the last 5 days, and where the actual number of people sick is now around 50. So that seems to indicate that something similar to that of what happened in New Zealand, that could declare itself free of pandemia after some time without any new case registered, could also happen in Uruguay. Now, the question arises, what is it that makes some countries fare better while their neighbors fare really worse and tragically? Is it the government responses to the pandemia, and how much does it affect that, for example, President Bolsonaro in Brazil has repeatedly said that this is just another cold, and refused to wear masks in public, or refused to or kept convening political rallies and meetings in the middle of the pandemic? Or is it a case related to the state of the health sector before the pandemic, or the state of the country before the pandemic, and what are the conditions that allow to react or not? Those are all open questions, but I've been trying to find some results, or some establish some correlations, and as detectives would do. And here we have, for example, a graph going since 2006 to 2017 about the health expenditure per capita in dollars in all these 8 countries, the 4 that did well or comparatively well, and the 4 where the situation is a disaster. And there we see, that Jamaica, which is one of the countries that is doing the best, has a very low per capita expenditure in health, which is related also to their overall economic condition. This is absolute numbers in dollars. So Jamaica in Peru are spending around $200 a year per capita in health, overall spending, all included. Mexico is not much better, with some $500. And on the other extreme, Uruguay and Chile are spending $1,200 and $1,600 a year per capita in health. Now, there is a little difference in spending, but Uruguay is doing much better than Chile so far in the pandemic. All the caveats and so on have to be put in there when we are talking about something that is evolving, and where these are not final results, and so the game has not ended yet. Brazil, Cuba, and Costa Rica spend more or less the same on health per capita, around $800 a year. And yet the results are extremely, extremely different. So there doesn't seem to be a correlation on the spending side, your capacity to spend or your actual spending in total and in averages doesn't seem to explain what is happening. But, and this is the big but, as you know, Latin America is the most unequal region of the world. This is a picture of Sao Paulo. So you have, as very close neighbors, the people that have a swimming pool in their terraces, in their own apartments, with the slum and the people that live under very poor conditions. What does it mean that these people spend, or that the health expenditure per capita is on average $800? You know, the people living to the left of the picture probably don't earn $800 a year. The people living to the right spend thousands of dollars in nose correction surgeries or other kind of surgeries which are qualified as health expenditures but are nothing more than cosmetics. So within that inequality, average figures of health expenditure in a Latin American country that is so unequal don't really mean anything. We find a correlation, finally, so that gives a clue to the detectives. When we look at domestic private health expenditure as a percentage of the total, and then we have Brazil on top. So out of the total of Brazil's expenditures in health, almost 60% is private domestic expenditure. So that is what includes the plastic surgeries and many other health expenses that are probably needed, but that only some people in a very unequal country can do. Whereas in Cuba, there is almost no private health expenditure. It's below 10%. People trust the state, or the state provides for all the health needs of the people in Cuba. And Uruguay, Costa Rica, Jamaica, the 4 countries that are doing better, they all have the lowest private health expenditure. If we see that the other way around, and we see in this graph the government expenditure in health as a percentage of the total, which is basically just the reverse of the previous one, you have, again, Cuba, Costa Rica, Uruguay, and Jamaica on the top, and Peru, Mexico, Chile, Brazil on the bottom. So there seems to be a correlation, even if it is not definitive, so to say, that you can say the more the government spends in health, the better the countries have been able to face the pandemic. Now, this is a temporary affirmation to make in the current international circles where the private sector and the private sector expenditure is highlighted as the way to go and recommended by the World Bank and many others as the way to go. The official development assistance doesn't want to waste the money with expenditures that may go to the middle or upper classes in beneficiary countries. They want to focus on the poor And therefore they say, let the rich pay for their own health. They have the money. Why shouldn't the rich pay for their own health and have private health services? Why should taxpayers pay for the health expenditure of the rich? Let's concentrate on the poor. Now, the result of that, the result of many years of applying that policy has been the destruction of the public health systems across most of Latin America, with some exceptions. And here you can see also in this graph how, for example, in the case of my country, Uruguay, government health expenditure as a percentage of the total since 2006 to 2017 grew from less than 50% to 70% of the total health expenditures. There was a massive investment in public health, in universal health insurance, and in public delivery of health services that resulted in that yellow line going up from fifth place among these countries to third place in terms of expenditure, in terms of percentage of government expenditure. Whereas you can see in Brazil in the last years, as a result of the Workers' Party, Dilma Rousseff being kicked out of power, a dramatic reduction of the health expenditures that continued after 2017. In the last 3 years, the government health expenditure has gone down quite more. And this is where pandemia or the results in the pandemia link with the politics. And this is where they link with structural situations, not with so much with the ideological orientation of the current government, but with what has been done over the years in the construction of a universal public health service. This is quite a verdict against the policies of focalized service provision. And this only reaffirms what Amartya Sen rightly said. Services for the poor end up being poor services. When the services are universal, the feedback, the accountability that is provided by the people that rely in the same services as the poor, but have a capacity to reach the elites in the power, in the decision making, create different formal and informal mechanism of accountability that increases the quality of those services. So the conclusion is what this demonstrator was saying in Chile, in the wave of people in the streets that shook the country in the months previous to the pandemic. Neoliberalism was born in Chile and will die in Chile. Neoliberalism was not born in Chile as a theory. In that sense, probably it can be attributed to the Chicago School of Economics, but Chile was the first country in the world that applied it to the extreme, privatizing everything that was to be privatized, including health, including pensions, social security, and so on. And it could only be done because that was done by force under the dictatorship of Augusto Pinochet. Now, neoliberalism was not undone in the years of democracy since Pinochet left power, or not completely, and people went massively out in the streets until the pandemic did not allow for that to happen anymore, as in many other countries in the world. But that doesn't mean that the worldwide wave of protest and emergence of activism that we saw in 2019 is in any way over. And we are starting to see, and probably as a result also of the pandemic, a second wave, a very real second wave of people in the streets demanding an end of the neoliberalism that is killing us literally, and demanding a new future. I think I will stop here. Let us take some questions. I haven't been looking at the time and I tend to talk too much. Let's go into some interaction, please.
Thank you. I'm going to try and, if you can hear me, because I'm just trying to test if my voice can travel with the video on. If that's happening, then I'll continue this way. Otherwise, I'll turn my video off. Yeah, I think what you just did here in your presentation is to actually explain to us, graphically in fact, the direct relationship between how much money we spend on the real thing that needs to be spent on, as opposed to the fake things that are made out to be, what broadly is, development is a catch-all phrase. So thank you for bringing together this type of analysis and explaining in a way that we can relate to the politics itself. And I agree completely. I mean, it's important that you bring out the fact that it's not necessarily ideologically driven, but the fact that structurally governments have displaced core priorities. You can see that in China, you can see that in United States, you can see that so it's really not a tension between capitalism or what is considered to be so-called communism in China, and definitely in India as well, which emerging from a mixed economy to what it is now. So I will ask you a simple question, and that is to really try and explain to us what you feel is going to happen, say in 6 months' time, if you can put on a journalistic lens and knowing as well as you do the world and particularly South American and Latin American region, can you tell us how this is going to play out in the way in which governments will behave, and whether governments will become more aggressive against the way in which people are now reorganizing themselves, because the normal forms of organizing are out of place. So when people try and find new ways to organize themselves and express their, views, disagreements or agreements, how do you think this is going to play out with the way governance works, especially in the Latin American context as well as the rest of the world?
Well, again, predictions are always difficult, and I don't have any kind of crystal ball. But there are some things that are pretty obvious. So we don't know how the pandemic will evolve, but we do know at this stage that the economic conditions in Latin America, as in all around the world in an unprecedented way, are going to be very tragic. For Latin America, we are going to face a collapse in the trade with China and the US, which are the two main trade partners, because of the drop in the economy in those two major markets, also in Europe. We are going to see a fall of commodity prices because of the lack of demand. We are going to see broken global production and value chains that are highly integrated but will not be as integrated as we have seen because of the trend towards protectionism, among other things. We are going to see a drop in tourism because people are just afraid to travel or forbidden to travel. We are going to see a drop in remittances by migrants. And we are already seeing a massive capital flight out of Latin American countries, devaluation of our currencies, and debt crisis, massive debt crisis. Argentina is already in a default situation. It's not paying its debt, and many other countries in Latin America and around the world will follow. This translates in massive unemployment in the North and in the South. And this translates, of course, then in the state having much less resources because of the drop in the economy. They will not raise the taxes as needed. All the conditions for popular dissatisfaction with the situation are there. And in highly unequal countries and countries where the trust between the people and the governments and the state has been broken, this will most likely conduct to more and more people in the streets. If we can put it the other way around, several UN studies and so on are trying to say, okay, what do the successful experiences of Latin America have in common? And basically, the things that have made so far success in the pandemic are free and universal public health services, early decisions based on scientific evidence, strong institutions, trust between the society and the state, and accurate public information that allows people to take their own decisions. My own country, Uruguay, never had a forceful quarantine. The government called on people, explained the facts, and called on people to behave responsible. Now, the drop in mobility, as evidenced by these statistics by the Facebook and Google and so on that trace your cell phones and know whether you are at home or not, the drop in mobility in Uruguay was more or less the same as in Argentina when there was a forceful legal quarantine, curfew, and so on. But then you had to open up all the exceptions because society still has to function. Somebody has to produce the food, and you know, the health sector has to function, and so on. So those factors that make up for a success in facing the pandemic, they require strong civil society, strong social cohesion, and government leadership at the same time, so to say, and some relation between the two. Now, in conditions of high inequalities, and so there is not coincidence that also another factor that the 4 successful countries have in common and that the 4 not successful countries have in common is inequality. The highest inequalities in Latin America are in Brazil and Mexico and Peru, which are the countries that have the worst situations in terms of the pandemic, whereas the lowest inequalities are in Cuba, Uruguay, Costa Rica. The exception to that rule is Chile, which has in the Gini index and so on, relatively low inequality, but where there is a strong perception of disconnection between the government and its people. And that probably explains a lot about how the pandemic got so bad in Chile. We have in Chile a government that in the middle of the demonstration, the president's wife, in a WhatsApp message to her friends saying, warning that a state of siege and curfew was coming and so on, was saying, we don't know what is happening. We don't know who these people are. It looks like an alien invasion. And she was talking about the people of Chile in the streets. Now, when you have a governing elite and a power elite that doesn't recognize its own people and sees them as alien invasion when they go out to the streets to demonstrate, then of course you don't have any trust in institutions and so on, and that leads to the worst possible situations in case of an emergency. Now, what is going to happen when the economy collapses, as it is collapsing everywhere, and where you need responses? Now, this can lead to all kinds of so-called populist, nationalist reactions. This can also lead to either popular uprising or a recognition of the need to attend to the needs of people. Things that were absolutely unthinkable some time ago, like universally guaranteed income as an expansion of social services, are now law in Spain and are happening in Spain. The governments are being forced, in many cases reluctantly, to go and assist their people way beyond because otherwise people will start dying of hunger, or the markets will collapse, and the whole economy is going to collapse if you don't have consumers anymore. I see a sign saying that there is internet stability, and it's also a good moment to stop. I don't know if that answered your question. The future is unpredictable, but we will see many, many changes. I would just add one thing that is happening worldwide, not just in Latin America, but it's happening in Latin America. What is essential in a society when you go into confinement, when you go into quarantines and so on? What is essential? And now we see that the people that are at the bottom of the social scales, the people that do delivery and the care, and all those things are becoming essential. And care systems and the care work, paid and unpaid, is now seen as essential. Now, care work is done by women in Latin America and all around the world. It is mostly unpaid, but it's being recognized as essential. So what does it imply for the future? I cannot see how this cannot be valued differently after the pandemic and structured differently. Interestingly enough, Uruguay and Costa Rica, before the pandemic, were already starting to incorporate to the social security system a right to be cared, meaning a recognition of care work at home and so on, as a co-responsibility between the state and the care providers, which are almost exclusively women, and in some cases a recognition that it has to be paid where it was unpaid or otherwise compensated as a state responsibility. Now, this new thinking in Social Security, which may have seen way off before, same as universal basic income, might show the things that we're going to see more of in the post-pandemic world.
Thank you very much. In fact, your explanation has helped Sydney, who had asked this question of how's Chile, seemed to be an aberration, but he thanks you for explaining that very well. And Su Ming Ku says she's grateful that you have, analyzed and exemplified a tale of the two Latin Americas. But she also has a question, and she asks, what factors drive sustained investment in public health in Uruguay, and what factors can help sustain it? And if you can also speak to the other countries you're familiar with in the world where I mean, you have, of course, explained what Spain has done after the pandemic to correct it. Yeah.
Yes, I think in that case, we see it's not just Uruguay, it's also Costa Rica, and it is, of course, Cuba, and so on. Another apparent paradox, the countries that in Latin America fare the best in the pandemic are the countries that have the highest life expectancy and the highest proportion of elderly people. Now, as you know, elderly people are the most vulnerable to COVID-19, are the people dying the most of COVID-19, and then countries with a high percentage of elderly people are supposed to be those that are going to suffer the most. At the same time, I would say the existence of a high percentage of elderly people in a way shows that the health system has been working, not in the last year, but in the last decades. And at the same time, it has built a constituency for a health system because health needs and the needs for care of the elderly people are more than that of young or young adults, and therefore these people lobby for a health system, lobby for health care. So it's a complex and very interesting setting when what seems to be a vulnerability, oh, you have a lot of older people. Actually, at some moment, some people were saying, well, the pandemic is a blessing for the people that are trying to destroy Social Security because you will get rid of all pensioners. You know, so you won't have to pay for them. Actually, this is not what is happening in Latin America. Is the countries that have a lot of pensioners are at the same time the countries that have better public health systems because of the lobby of those same pensioners. I think that a combination of unionization, high degree of unionization, and strong women movement. I mean, the whole push for better health care and the whole push for care systems that recognize that the state is also responsible for care comes of the women movement in the streets demanding that.
Excellent, thank you. I think that connection that you bring in between movements, especially women's movements, and the fact that trade unions have organized over time is the kind of lesson I think which should travel around the world. And on that note, I actually have a question from Facebook. It's also being webcast live on Facebook, and Devi Karani wants to know a bit more about the Latin American insurance coverage for healthcare. Yes, there is public health systems, but in some certain countries, but what about insurance? Does it come in as a public insurance package, or has that played a role in helping people survive this pandemic? And in countries where such systems are not operating, how have they fared?
Yes, what we have seen in the last years, traditionally, health insurance was same as pension system and most of Social Security associated with work and jobs. So workers would have, and employers would have to pay a percentage of their salaries to a health insurance system, and they would get health insurance. Now this applies to formal workers. And of course, informal workers don't have that insurance. People that work in the informal sector, or that are micro entrepreneurs in the market and so on, don't have health insurance traditionally. Now, this is something that during the so-called pink wave of progressive governments in Latin America started to change. And in some cases, and the best known examples, the fastest way to produce some change was to just give poor people money directly, without intermediaries. You get a card, you can withdraw money from the bank. But other countries, and again, this is the case of Costa Rica, this is the case of Cuba, to some extent of Chile, but much less so, started to improve social services and health and education and so on. So the way for the state to redistribute was not to just give money to the poor people, but to give social services. And so the change, the adoption of universal health insurance to which you have access, whether you are a worker or not, in the case of Uruguay, is what explains this increase in the government expenditure in health over the last 15 years. And it is paradoxically what allows a neoliberal government that came to power on March the 1st and declared the pandemic emergency 2 weeks after being in power, is benefiting, collecting harvesting the results of the previous 15 years of public investment in health that during the electoral campaign were deemed as excessive. In a similar way, the capacity to do testing, and this is another factor, the testing and the massivity of the testing highly correlates with success in fighting the pandemic, is related to the existence of public universities and public investment in research and development. And that, the budget of these institutions had to be increased to allow for example, the production of local respirators. And we found some very interesting things. The price of respirators increased with the pandemic from some $30,000 each to $50,000 each. And even so, at that almost doubled price, it was impossible to buy them for a small country that didn't have the pressure on the market. We saw those scenes of people at the plane fighting to where the masks were going to go, and small countries don't have that capacity. Uruguay started to produce the respirators at $1,500. And luckily, then they were not even needed. But that also changes the notion inherent to neoliberalism that you earn money in the way that you are most effective, which for Latin America means to export raw materials and food, and then you will buy whatever you need, has proven absolutely untrue. You cannot buy what you need when the rich and powerful need it also. So you have to have some degree of self-reliance.
Thank you. I think you already addressed the importance of popular movements and how it has pushed towards universal health care, and also the role of, in particular in Uruguay, you spoke of how the government educated the public to work itself out of the pandemic. But Swaminathan wants to know if political ideology does dictate the promotion of universal health care. Of course, you analyzed how neoliberalism obviously does not provide for investments in those sectors. But what do you think could emerge if popular pressure could be directed towards the fault across the world, which is the promotion of neoliberalism in such a pandemic way?
Well, I don't see the promotion of neoliberalism in the way of the globalization that was promoted by Bill Clinton and Tony Blair and the likes as having any chance of returning. So people, out of rejecting that, are going more into neo-nationalism, you know, my country first, and the closing of borders, and the pandemic also, and we have to be aware of that, creates a mentality of threat coming from abroad that we need to close, creates a mentality that godly punishment, so somehow sacrifice has to be imposed, and of course confinement and social distancing, physical distancing is a big sacrifice that people resent, and if they don't understand why it is needed, it's even worse. So that can give rise to that kind of things. There are people that say, well, the 1917 badly called Spanish flu pandemic somehow contributed to the rise of Nazism and fascism in Europe. Well, and this could happen again. What can I say? It could. You see trends. We see those kind of dangers. It could also lead to a different way of imagining and seeing the contract between the market, the state, and society. And I think that internationally, you know, the absolute failure of the private sector to constructively work from the pandemic had led many governments reluctantly. They wouldn't want to, but they had to take the lead. So things like industrial policy are now kind of obvious. You know, government ordering car makers to produce respirators. Now, this is not globalized neoliberalism. The market is supposed to see the advantage of building respirators and sell them and so on by itself. But that is not happening. You know, the private sector acting for its own immediate interest, as they are doing, is not helpful at all. And so things that were unthinkable, like capital controls, industrial policy, helicopter money, so-called. Government has to start fabricating money and distributing it, are now the part of that new normal.
Sydney, would you like to ask that question directly? Because I see that a part of it has come through. It's Sydney has a question about the situation in Chiapas versus the rest of Mexico, and I think it also speaks to the situation across the world where indigenous communities, when well organized and develop their own systems, how do they work in this type of a pandemic situation? And that could also be a possible sign to the future of what kind of systems we should probably argue for more and more.
Yeah,
I don't think
thanks.
Sydney can.
Yes.
Yeah, Sydney will
thanks.
want to. Yeah.
Yeah, I think you've pretty much got it. I was just interested in the Mexican figures, and if you've broken it down into a. Can you hear me? Sorry.
Yeah, we can. Yeah, we can hear you. Yeah.
Okay, and if you've broken it down into the areas, because I was interested in Chiapas so as a very different model of organizing. And that also brings you to places like Rojava, and there may probably other places in the world where there's a high level of trust between the people and the local authority. I wonder if you could comment on that.
Yes, well, I'm not very familiar with what is happening in Chiapas right now or facing the pandemic. The case of Mexico is very interesting in that the Mexican government has been reluctant to impose the kind of confinement, quarantine, and so on measures at the beginning. Not for the same reasons as Bolsonaro or Trump, kind of ideological reasons that pandemia is not true, or a conspiration by the Chinese to bring us down, or something like that, but rather by fear of the economic consequences that could be as bad on the people as the pandemia itself. And so there has been attempts at doing differently, not very successfully. But again, in the case of Mexico, my understanding, I may be wrong, is that the pandemia is concentrated in the city of Mexico, which is probably the largest city in the world with 25 to 30 million people, highly polluted, highly contaminated, and where, you know, it's quite different, the situation of distancing, of air quality, and so on in rural areas or in other remote areas or in smaller cities. So those are factors that also need to be taken into account when we just see at the pandemic. In that sense, I think part of the reply, and it was interesting to hear some of the experts of the Argentinian government that has imposed very, very strong measures of isolation, curfew, and so on, and has more or less managed to stop a dramatic increase in the deaths. And basically, medical doctors that are in charge of advising the government and so on, they say, we have so many unknowns here that what we are doing is acting like firemen. We go where there is a fire and work on it. You know, so that what that requires is a good information system and the ability to detect that the new clusters that are emerging and concentrate and go and address them, you know, and as they learn. But under heavy pressure, you know, to open up, to end the curfew, and it's a big debate of what comes first, the economy or the health of the people. And that is universal, is happening everywhere. But I think that so far, the governments that have more or less explicitly chosen for the economy are those that are faring the worst, and not just in terms of health, but also in the longer run in terms of the economy. Because, you know, if people are dying, unhealthy and so on, you don't have an economy without people.
Thank you.
Yeah, thanks. We read in today's paper in India that people who live in slums are twice as much, twice as likely to be infected. Now, this was no rocket science, but the fact that India went through 60, 70 days of lockdown to prevent exactly that reveals that there are responses which were required to attend to this possibility and the dismissal of such responses, we now are staring at a very, very serious problem, especially affecting the slums. And it's not just unfortunate, but it's also a statement of the quality of governance, which structurally does not care for the people who need the most amount of care. Now, we also know that frontline workers who are most exposed, especially not merely the doctors, but not also the nurses who are, not well organized, but fairly organized, but the extensive network of sanitary workers who keep cities clean, keep villages clean, who keep hospitals clean, are grossly neglected. Their needs are grossly neglected. And this is also adding to the burden of the pandemic as they go about doing their jobs and, unfortunately get infected and so on. Now, are we, this is one of the situations which I don't see or hear the UN bodies speaking to. And you work extensively with the United Nations bodies, and in particular, why is the WHO not structurally analyzing the responses? Is there a patent, is there a basic inability because of their position as being part of the United Nations that they cannot speak truth to power and explain why such responses cannot solve the problem, perhaps even magnify it?
Yes, well, there are many factors here. Since the start of the pandemic, the situation of the slums all around the world has been a concern. Now, the experience of Latin America has been that COVID-19 started in most cases with the upper middle classes. And there is a reason for that. It's the people that have more international mobility, it's the people that travel to Europe for tourism or business and so on. And so they bring the virus back with them. And this has been a pattern. At some moment in Brazil, 1 month ago, the map of the municipalities with the highest human development index and the map of the municipalities with the highest COVID incidence was basically the same map. So again, saying, oh, this is a disease of the rich, or it seems so. That's where it spread the faster. But I think that talks about the way highly unequal societies are structured, that people talk and meet and socialize with their peers of the same social strata, and very little, except for domestic service or chauffeurs or cleaners, with the people in that actually live in the slums. There is very little contact, and that probably explains why the spread to the slums was slow to happen. And now this is happening in Buenos Aires because of the way that urban Buenos Aires is structured, where you have slums downtown in the center of the city, not in the surrounding areas. And their social interaction is higher. And of course, then the pandemic becomes worse because you don't have the conditions for isolation and so on. But in the case of Argentina, there is being a concentration of the resources to combat the situation in the slums. This is not happening so much in Brazil yet, but there is, for example, there is information about the pandemic spreading into indigenous communities, and there with catastrophic results. So it's a mixed situation. We are in the middle of it, and we still don't quite know how it will evolve. So at the same time, we see new ways of organizing or old ways of organizing, like popular soups, communal eating places and so on that are getting revitalized so that people can tend for their very basic needs and forms of solidarity, because government is not willing or able to provide. And this again may have an impact in how people organize and structure for the future. But it's a bit too early to say. I would think what other factors, components in the multiplicity of things that make out for vulnerabilities or for immunities. What kind of immunities have people acquired when they manage to live and survive in the awful sanitary conditions of the slums? So, that is also a factor that may be benefiting, within inverted quotes, people that live in the slums, that they have been exposed in their lives to several communicable diseases before, and they have survived. I mean, we know that the mortality rates and so on are much higher in those areas, but those that have survived may have some kind of extra immunity that other people may not have. But this again is just, I am advancing as a journalist affirmations that are very risky and not yet in any way scientific. So I'm just trying to say, okay, let's think out of the box. Things that are happening here are clearly not what was predicted or predictable. The predictable thing was a completely different world where the US was the least affected and the better protected country. That world is turned upside down. Let us think outside of the box that GDP money protects you, which doesn't.
I think that's an excellent point, and I want to invite Meera. She's made a couple of comments. Meera, would you like to unmute and ask, comment on what Roberto just said, and also the question you raised about the mental health consequences of global lockdowns, not just, am I audible? Meera? Yeah, I think I'll just read out her comment so that.
Just got unmuted. Huh?
Okay, go.
Okay.
Yeah, please go ahead.
Roberto, there have been from suicides to fear, discrimination, hatred, all kinds of things happening because of the fear factor and the otherness of people who are seen as spreading the infection. Now, as you mentioned earlier, it was basically the more privileged people who brought it into the country, but now it's the migrant laborers and the poor people who are going from the slums to their villages, who are in quarantine and all that happening in India. So the spread is in the slums now, because overcrowding and people, ventilation, food, under no work, no livelihood, no security, stress, so many things. So that was one question I wanted to ask, and there's one more. I think it was in 1995, Bridging the Gap report of WHO. I think it was in 1995. So, which basically said that the International Classification of Diseases, 0.5 or one of ICD 59.5 or maybe some number like that. But it was that the increasing inequities between countries and within a country was associated with increasing poor health.
Go ahead, Roberto. I think internet
Um,
is playing up in many places today. Yeah.
Yes, those are very, very
And
interesting.
this would probably be the last comment.
Yes, mental health has been, as far as I can tell, completely ignored in the measures aimed at combating the COVID-19, at least in Latin America. And we do see side effects as increase in domestic violence, affecting women, but also affecting children and elderly people. We see an increase in suicides. We see, you know, mental health clearly being uh, put at risk because people are under stress, fear, anguish, and so on, and combined with isolation is very unhealthy. You know, we humans are social people and we need socialization. And in that sense, the cost of the pandemic in terms of health is more than just those that die with a positive test on the presence of the virus. All around the world, there are starting to appear figures of excess deaths. On top of those people that have been diagnosed with COVID, there are many other more people dying in the countries most affected by the pandemic than normal, than the normal curve of people dying in this time of the year in the average of the previous years. So this excess death could be of people with other kinds of diseases that just the health system is unable to care for because it's concentrated on COVID. There are no hospital beds. The preventive health has been stopped and so on, and many other factors. At the same time, other interesting things are happening. In the case of Uruguay, when they tried to look at those statistics of excess deaths, they found out that in the 2 months of lockdown, there has been in total, including the people dying of COVID, 500 deaths less than on similar people of the previous years. And that relates with no street accidents, because people are not circulating, and a drastic drop in other communicable diseases, cold and influenza and so on, because of social distancing and because of hand washing. One of the reasons as to why COVID kills many more men than women simply seems to be that women wash their hands much more often because they do the unpaid housekeeping jobs that require them to wash their hands. And men don't have that habit and practice, and that puts them now under more risk. And in all countries, you see much more men dying of COVID than women. So again, the way things influence each other is complex and unexpected sometimes.
Thank you. And I really must say that, there are some more questions, but yes, we've been together for almost 2 hours. You must be pretty tired responding and talking to us. And Martha says, will this be documented as a report? Yes, we have a plan to actually come up with a publication which synthesizes all the all the talks. Once we reach, I don't know, the magic number of a dozen talks maybe. But in any case, these talks are going online on esgindia.org and YouTube channel, and this can be shared. It's also gone Facebook Live. I just noticed that quite a few people are watching this on Facebook as well. Some questions came from there. But yeah, I mean, lots of thanks to you from everyone who's participated on Zoom. They found this one of session. I must turn off my video, sorry, because my internet is slow. Yes, and like Joseph Brito says, very clear and meaningful session. Minar says thanks and he's really loved it. Manjulika was, I mean, we have had so many people who are entrenched in public health work, in governance, who have participated today and are grateful that you took time to share your time with us and your insights. So really a very heartfelt thanks to you for making time for us. And friends, this has been a great, one more great analysis and talk which looks at the present but with the intention of trying to prepare the world for the future beyond the pandemic. I just got one more comment saying, Margaret Berger says, thank you so much, Roberto. And she is very happy that she joined from Durban, South Africa. So it's also, I saw friends from Europe and North America as well. So in a sense, I think you have brought together the world's complexity in a language which is so accessible and simple. So I must, say that this is a talk which we are going to share a lot. And yeah, thank you again for this. Yeah, next week we continue with our 9th talk, and it will be from North America, from Washington, DC. It will be a talk by Aaron, who is one of the key figures in what is broadly called as Black Lives Matter. But he's actually looking at how his work has largely been in promoting tolerance, interfaith, and trying to see why in a world where there is so much possibility of coming together, we seem to be distancing from each other. And we are not talking about COVID-related distancing, but the other forms of structural distancing. In the case of United States, it is the president himself promoting racism. And here in India, we have communalism and bigotry, which is being actively promoted. So he's going to speak to that reality in the context of what the pandemic has done to all of us, and try and imagine the future. And he comes from a lot of work with the youth across the faiths in America, the Jewish, the Black communities, the Christian communities, and also Hispanics and so on. So I invite you to join the same time next week on ESG's Web Talk series. And Roberto, thank you very much for making time. And once the link is ready in a few hours' time, we'll put it up on ESG website and our YouTube channel. So please do share it. Thank you all.
Thank you. Been a real pleasure to be with you.
And I must thank my co-host Bhargavi, my colleague Sana, and Shrestha have tweeted this as well. So please go on to ESG's Twitter handle. Also, we have copied you, Roberto. Your speech has almost been typed out by them already. It's on Twitter. Yeah, thank you. Thank you, everyone.